Hello. So today, this session, we're going to be looking at Unit 23, an Introduction to Dementia, page 101 in your workbook. Okay, and we're going to go through each question. You need to have the PowerPoint slide up as well at the same time. Have a look through that as we're going through the video. There's quite a few videos, short clips, links to videos on the PowerPoint, and again it's really important, as with the other units that you've looked at, when there are videos, to look at them because they will support the evidence that you can provide within your answers, and they support the PowerPoint presentation, and they support, like I say, the questions. So by the end of this session, you will know the importance of person-centred approach when working with individuals with dementia. You will know the main causes and effects of dementia on the individual and their families and friends, and you will have a more understanding of the importance of effective communication for individuals with dementia. So we're going to first look at page 104 and start with question 73, which is asking you to outline what is meant by the term dementia. So it's really important that we know what the term dementia means before we can answer some of the other questions. And as I say, the first slide, I've got a video for you to have a look at. And then the next one tells you a little bit about what dementia means. So dementia is the name for problems with mental abilities caused by gradual changes and damage in the brain. Dementia is a word to describe a slow loss of memory and thinking skills. This happens because cells in the brain stop working properly. The parts of the brain that are usually affected are the parts that control how we think, remember, and communicate. Now, some of you may have experienced living with somebody or knowing somebody, a family member, a friend, who has dementia. So you may already have experience of this, which is, will be useful for you when you're looking at some of the questions, because you'll have some your own experiences that you will be able to use within your answers. Now, dementia is a complex syndrome affecting brain functioning relating to irreversible loss of cognitive, which is mental, capacity, and memory, such that there is a decline in a person's behaviour and ability to function socially, physically and emotionally over time. Now, some of you that have experienced somebody with dementia, you will know it's really, it's a terrible thing to happen. You will know somebody, or they will know you, or they've known you, and then all of a sudden, over time, they won't recognise you. They might recognise you one minute and then not the next. And this is it gradually deteriorates and affects them in this way. Dementia is a complex umbrella term consisting of approximately 60 types of neurological disorders that doctors recognise. During the course, we'll look at the 4 types of dementia. So this session will look at 4. Excuse me. Alzheimer's disease, vascular dementia, dementia with Lewy Bodies, and frontotemporal lobe dementia. So we're going to now look at some of the facts and figures of dementia. So dementia is not a normal part of the ageing process. However, the risk of developing dementia increases gradually with age. The likelihood of someone developing dementia at age 60 to 69 years is 1% for women and 1.5% for men. And the likelihood of someone developing dementia at age 90 years or more is 33% for women and 25% for men. We do not know exactly how many people in the UK have dementia, but in 2011, figures estimated that 670,000 people over the age of 65 in the UK had dementia. This was only an estimate, Now they estimate 850,000 people. Dementia is a growing condition, with 7.7 million new people being told they have dementia around the world every year. That means someone is diagnosed or being diagnosed with dementia every 4 seconds. That's a very, very high number of people. The number of people with dementia worldwide is expected to nearly double every 20 years to 65.7 million in 2030 and 115 million in 2050. So that's some factual information there, some facts and some figures, just to start to get you thinking about, dementia is really big, and there are a lot of people who are getting diagnosed with it. There are many myths and stereotypes also about dementia. So there are many negative myths and stereotypes associated with it, and this can lead to misunderstanding of the disease and stigma and discrimination. And we talked about discrimination in Unit 5 when we looked at equality and inclusion. The myths and stereotypes can stop people or their families from seeking diagnosis and treatment. They can also stop people from talking about dementia. So here's some examples, and it's on the slide, of the myths and stereotypes. So you may hear people with dementia are crazy. People with dementia are mad. People with dementia are senile. And you will see on the slide, these statements are incorrect. Most people living with dementia live in their own homes and care for themselves, or they have the support of family members to help them. However, some people with dementia live in residential care or nursing homes. And these might be the people that you're working with as health and social care. You may be working in a specialised care home, supporting people with dementia. You may go into people's homes to help them with everyday activities like washing and dressing. So these are some of the things that you may experience. So these stigmas of dementia need to be removed. There is no longer a stigma of cancer. People, years ago or not so long ago, people assumed if you got cancer, then you died. And actually that's not true. We are curing, people are living longer, they're overcoming that. To remove the stigma of dementia, people must have an awareness and understanding of it before we can remove it. The next slide takes you to another short video, and again it's really important that you watch the video. It's a true story, and it will help you to, we're going to look at some of the conditions under the umbrella term, like we talked about, some of the 4 conditions, and then this video will help you and look at, those conditions. Okay, so we're now going to look at page 103 and look at question 72. And it's asking, 72A is asking you to outline why it is important to recognise and value an individual with dementia as a person first. And you will see on the slide there is some information, and dementia is not the same for everyone. It's important to recognise and value an individual with dementia as a person first, because not every person with dementia will need the same type of care. Now, we've looked at that already throughout some of the other units, personal care, personal support, that person-centred approach is different for everybody, because everybody is an individual. And that means anybody. So no matter what, we looked at children and adults with autism, we've looked at mental health issues, and we're looking at dementia, and everybody has different needs. So that is why it's important to recognise them as the person first, so that we can support their individual needs. We'll then move on to question 72B. And it's asking for 4 examples of how to use a person-centred approach when working with individuals with dementia. And again, very similar to what we've already looked at in the last 2 units. It's important for us to find out as much information as we possibly can about that individual. So asking the person you care for what they want, finding out from them themselves what they want, And sometimes in the early stages of dementia, you will be able to do this a lot easier than when they get into the later stages. And then, so one of the other ways we can find that information out is by talking to their family and asking their family about their individual needs. Making sure you understand them by asking their family. Asking, putting that individual at the centre of their care plan. So once you've got the information, making sure you stick to it and putting them at the centre of their individual care plans. Another way is to look at their preferred method of communication. Again, we've looked at this throughout the other units, but find out what is their preferred method of communication. Do they use sign language? Can they use Makaton? Or do they need to write things down? So, that's really important that you find out their preferred method of communication to actually provide that person-centred approach. So there's some examples for you to use. You can use the PowerPoint slide as well, and obviously, you can find out your own information, do some research, and again, you might have experience of working or knowing somebody with dementia, so that's important. You can use that information as well. Okay, we're now going to look at question number 74, which is on page 104, and we're looking at giving at least 4 examples of causes of dementia. Now, earlier on, we talked about the 4 different types of dementia that we're going to be looking at throughout this unit, and we're going to look at the first slide, which talks about Alzheimer's disease. And Alzheimer's disease is the most common type of dementia in the UK. The exact cause of Alzheimer's disease is not yet fully understood, although a number of things are thought to increase your risk of developing the condition. And on the next slide, there is a short YouTube clip which actually looks at someone living with Alzheimer's disease. So that's really important for you to watch it again to get more of an understanding of Alzheimer's disease. On the next slide, we'll look at vascular dementia. And vascular dementia accounts for around 10% of the cases of dementia. It's a less common cause of dementia. In vascular dementia, there are problems with the blood vessels within the brain. This can be seen on a CT or an MRI scan. And there is another clip, another video on the next slide, which is a daughter's perspective and of her mum having dementia. So again, make sure you watch the YouTube clip. We then look at frontotemporal dementia, which is an uncommon type of dementia that mainly affects the front and sides of the brain, and this causes problems with behaviour and language. And the last one we'll look at is dementia with Lewy bodies. So Lewy bodies are clumps of protein that develop in the brain, resulting in dementia. Some people may have more than one type of dementia, and this is called mixed dementia. And people with Parkinson's disease can develop dementia with Lewy bodies as well. So what causes dementia? And we often hear ourselves ask, why do some people get it and others don't? So this is something that we're going to look at right now. And on the next slide, the causes of dementia. There's a list: Huntington's disease, age, alcohol use, high cholesterol, diabetes, Down syndrome, HIV status, multiple sclerosis, genetics, hypertension, mental illness, Parkinson's disease, smokers, diet, lack of exercise, and metal exposure. So there is a long list there of causes of dementia. And you will see on the next slide there are some, it's got normal aging and dementia. So your normal aging versus dementia. So have a look at that slide, and again, it's some more information to support when you're answering the questions. So we're going to look at page 105 and question 75 now, and it's asking you to outline the effects of dementia on individuals, families and carers. And you'll see there's 3 different boxes to write this information. The first one being individuals, the second one being families, and the third one being carers. So dementia can affect the individual in many ways. It can affect the brain by changes in personality, in memory, emotions and behaviour, vision, language, body control and spatial awareness. It can affect their personhood by self-identity, loss of lifestyle, loss of independence, inability to recognise family and friends, an inability to remember where they live, and an inability to stay safe. So what I would like you to do is to think of some of those, and you need to write a sentence by outlining the effects that dementia can have on an individual. I'll give you an example that you can use and again, but put it in your own words. So the effects of an individual with dementia is that their personality changes. They can sometimes become quite aggressive. They may also not recognise family members or not remember where they are, which can cause distress. So there's one example that you can use to help you write your outlining of the effects dementia has on an individual. So we're now then going to look at how dementia affects friends, family and carers. So as I say, you need to do families and carers. So family can become carers. So some families do choose to care for, maybe it's a parent who has dementia and their parents will care for them, so the family become carers. Time management, so caring for a person with dementia, it's a full-time job, so actually that might have an effect on the family members' life. They may have to give up their full-time job to care for their family member. Loss of past relationships with the individual with dementia as they forget who they are. Family and friends need strong support networks. Caring for somebody with dementia can be expensive. So again, like we said before, there could be loss of earnings because a family member might need to give their job up to care for their family member who has dementia. It puts stress on relationships. So with your own husband and wife, if you're caring for a parent, it could put stress on the relationship because, like I said before, it's a full-time job. And lifestyle changes. So, you might not be able to go on your annual holiday because you have to care or you have to sort the arrangements out for your family member. So I'll give you some examples. So for family members, so some families will take on the role as their carers. This can be quite stressful on them because they could lose their patients, which will make them feel guilty. They may lose their job or give up their job because they have to care for their family member. Carers, so a dementia carer can have an effect on them as they will no longer be able to plan ahead. For example, go away, they will need to put the dementia sufferer first, so they might not be able to go on holiday, like we said before. There's another example that you can use. We're going to look at question 76 now on page 106. And we're going to identify 4 benefits of effective communication on the lives of individuals with dementia. Use the slide to help you. So, communication is important because it builds trust between individuals and care workers. So you'll build that trust between that person and the care worker. It supports the relationship with families and the individual with dementia. So by communicating, you can support everybody involved with that person. You can communicate with that person and how they are feeling. So that will help you to know how they're feeling and be able to plan the day, plan around what you want to do that day. People with dementia will feel less worried. So if you're communicating with them, you can reassure them. You can, you'll see in the video that you watched earlier on with the mother and the daughter. And, she had to reassure her every day. She was giving her reassurance. She had to, she was heartbroken and she had to reassure her every day. So that's something you might have to do. And because people do forget, like I said before, there's memory loss. They will forget things they've already been told. And the person with dementia will feel part of their wider communities. If you're communicating and you're sharing things that are going on, they're going to feel part of that wider community. We'll look at number 77 now on page 107, and it's asking you to outline how memory loss affects the use of spoken language in an individual with dementia. And again, look at the slide. There's lots of points on the slide. You just need to put them into a sentence. Dementia can affect spoken language, so they cannot remember common words. Because memory loss, it affects them remembering common words. Using the wrong word, so they may use a wrong word because they've forgotten what the common word is, so they may use a wrong word. They may forget names, dates, places. They may not remember who really important people are. They may forget the name of really important people, and that can be quite heartbreaking for that person as well, because their mum, their father, they don't remember them, they don't remember the names, and they don't actually remember them sometimes. They may go from one subject to another in the same sentence. They may have difficulty hearing but are unable to tell you this because they can't get the words, they haven't got the words to say it. Dementia is progressive and it gets worse over time. It slows down the thinking, it makes it difficult to understand information, and it stops people communicating completely because they forget the meaning of words and that to make a conversation, so that can actually stop them communicating completely. And the final question, 78, is asking to give 4 examples of techniques that can be used to facilitate communication with an individual with dementia. And again, use the slides to help you. When communicating, we've talked about communication before, but it's just to reiterate it. So you need to give 4 examples. So make sure you use eye contact when you're communicating with people. Make sure you smile. Make sure they can see your body language. Talk about active listening skills. So make sure you're nodding and you're smiling. No interruptions. Speak clearly to help them understand. Be patient. Give them time to find the words to reply to you, and that's really important. It's really important with everybody, but especially someone with dementia. Give them the time. Let them think about what they're going to say. Use a friendly tone of voice. Don't shout. Don't whisper. Make sure they can understand you. Hold or pat the person's hand so they feel safe. That's sometimes, that's somebody touching somebody to know that they're safe. And use pictures from the past to help them find happy memories. You can get pictures, to get the families to bring pictures in. So, there's some of the examples and techniques that you can use to support communication with someone with dementia. And that completes this unit 23. So thank you for listening. And if you've got any questions, please just ask me, and I'll be able to help you further. Thank you.